A study was done in 2021 by the Commonwealth Fund, and the results of it are now available. Studied 11 countries, wealthy countries, and their healthcare systems. Can you guess where the United States lands? You don't even have to narrow it down to one area. It's not simply bad or good. How about where did we land on access to care process, administrative efficiency, equity, healthcare outcomes? Where do you think we landed on any one of those? You could probably tell from my tone where we landed. But let's Evel Knievel this. Let's take a couple of laps around the ramp. For our assessment of healthcare, the Commonwealth Fund writes, system performance in Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, the United Kingdom, and the United States. We used indicators available across those 5 domains: access to healthcare, care process, administrative efficiency, equity, and, of course, the outcomes. How healthy does the population get as a result of that? Well, gosh, let's break it down one at a time. Healthcare system performance rankings. Oh, where is the U.S.? Where, oh, where? Oh, number 11, 2, 11, 11, 11. Okay, well, fair enough. Maybe our system performance just isn't good. You know, the infrastructure of the thing. How about our comparative healthcare system performance scores? As in, when we compare all these countries together under the same conditions, how do they perform? I don't even see the U.S. It must not be on there. Oh, wait. Lowest performing. Let's make this more blatant. Let's look at when we purchase healthcare. How expensive is it as a comparison of our total spending on all things combined? We're at the top. U.S. spends the most. U.S. spends the most by a wide margin. What about comparing it to how much we spend? How much the average American spends on healthcare? With the lowest service and paying the most of all countries in this study, 11 countries, U.S. The pitch they keep giving us is it would be too expensive. Well, my God. It already is too expensive. And we don't get the health care. Affordability. As in, can you afford the health care of the country if you live in it? The U.S., lowest performing. Equity, as in, can you afford it if you're not rich in that country? Virtually identical for the U.S. An embarrassment. One thing I'm expecting to not hear, beginning with those of my generation and ever onward, is that America is the greatest country in the world. I just don't believe we can make that argument anymore because the facts do not bear it out. Lots of countries have freedom. We act like we have a monopoly on that. We don't. People are plenty free in Canada. People have freedom of speech in countries all around the world, not just the United States. There's a freedom of press in countries all around the world, not just the United States. What is it we have that's so great? I'll tell you what it's not. It's not healthcare. Certainly isn't healthcare. God help you if you're poor. It's not healthcare. What are the conclusions? If we can stop being arrogant and we can stop saying that we are the absolute best and therefore anything we have done must be the best way to do things because we are the best, if we can acknowledge for a moment that this is us, that this is who we really are when we look at the numbers, if we can acknowledge that and we want to change that, then there are 4 things they've identified that the top performing countries do that the bottom performing countries do not do. They provide for universal coverage and remove cost barriers so people can get care when they need it and in a manner that works for them. Let me just say that first part again. They provide for universal coverage. Universal coverage. It's universal health care, Medicare for all. That is what they do. They invest in primary care systems to ensure that high-value services are equitably available locally in all communities to all people, reducing risk of discrimination and unequal treatment. In other words, we have privatized healthcare right now. Businesses try to go where the money is, where they feel they will be most profitable. And so we wind up with healthcare catering to the rich, not just in terms of the services they offer, but literally where they offer them. They reduce the administrative burdens on patients and clinicians that cost them time and effort and discourage access to healthcare, especially for marginalized groups. Case in point, think of our abortion laws currently. Think of how much the GOP has been allowed to harass scared, traumatized, sad, young girls, or rather young people that can get pregnant. Let's not even be that specific. Think of how much they have been allowed to do that. A civilized country does not allow that to happen. They invest in social services that increase equitable access to nutrition, education, child care, community safety, housing, which we have discussed many times on this program, transportation. Remember what I was saying about being able to cross the area you govern using public transportation. In other words, cross the land as though you are the poorest in it. And if you're unable to, then you have failed, and you must address that. And if it is a requirement that you cross it, better find a way. Because the people you're governing have to. And worker benefits that lead to a healthier population and fewer avoidable demands on healthcare. Don't ignore that last sentence, even though they chose to use science guy talk. I truly wish there were science communicators on every staff of scientists, because I got a double take every time I read these. It's beef I have with folks that have about 2 more degrees than I do. And fewer avoidable demands on healthcare. When they say avoidable demands on healthcare, they're just saying fewer health concerns. Avoidable demands on healthcare, you got screened for cancer, which is why you got a 1-day in and out quick operation. Saw a spot, it was on your skin, we cut it out, come back in 6 months, we'll make sure nothing's there. As opposed to, this mole is discolored and oddly shaped, but my God, I can't afford to go in and get how much does a punch biopsy cost? Oh, no, I don't have $2,000 or whatever. So then it becomes cancer that metastasizes, spreads through your body, and now instead of one simple operation, you've got a so-so chance to survive it all, and it is going to take you many trips to the doctor and many complicated operations. That's an avoidable demand on healthcare. But we live in a country that equates a human being's worth to the dollar bottom line. And everybody wants to increase their own worth. Everybody wants to strive. We keep saying the American dream is money, money, money. And we keep giving people less and less money for the work that they do. Resulting in this. Resulting in an absolutely embarrassing state of American healthcare. That's our performance versus our spending. We are spending the most. We have the lowest performing healthcare system of all countries measured in this. Was it every country in the world? No. Just the top 11 richest. When I was growing up in America, if we were number 2 at anything, we attended to that right quick. Look, I still got that old school, maybe slightly problematic American pride. I don't like not being number 1. Just because I don't think America is number 1 doesn't mean I don't want to put it there. We ought to be number 1. We have the resources. We have the education. We have the ability right now. Let's make it happen. Contact your representative. What can you do? Tell them. You want Medicare for all. That simple. Bernie was right. Healthcare is a human right. And if there are 10 other countries out there wiping the floor with us, why do you think it wasn't a nice round number like 10? Why do you think it was 11? Because we wouldn't have made the list otherwise. We wouldn't have made the list. You hear that? I hope it offends you as much as it offends me. I hope it embarrasses you as much as I am embarrassed by that fact. Whole world can see that. The whole world sees how we have dropped the ball, how we have let greedy people steal from us to the point that we are literally dying for it. Unacceptable. Tell your representative, if they represent you, if they truly represent you, and if they expect your vote, they better advocate passionately for Medicare for all. I don't care what excuse they have about the House is this or the Senate's that. There is always an obstacle to overcome. We need to hold this list up. We need to shove this study in their faces, and we need to demand Medicare for all.